In June 2019, at the University of Hull, Dr. Ann Hutchinson coordinated and presented an exhibition of artwork created by people living with breathlessness. Participants were encouraged to work with sound artist Dr. Rob McKay and visual artist Anna Bean to produce art that represents their personal experience of living with breathlessness.
I think it's fantastic. I mean, you can see that by the number of people that have come to see it. It's a really important piece of work. It's doing something that other research doesn't do. It's very innovative. And what art does particularly, and what this project does particularly, is it gives a really clear insight into what it must be like to live with this particular condition. Now, we can sort of ask people and talk to people what it's like, but with art and the representation of people's experience, you can actually magnify it to something that's really clear and important and a really strong message. And what's come across to me is how people can't do the things that everybody else would take for granted. Like walk up a flight of stairs, do some housework, go out in the garden, enjoy the fresh air, that sort of thing. And I think that with art, you can do that, and it makes it sort of accessible and people feel as though they're involved in it. So I think it's brilliant, and it's going to go around different GP practices, and we've had quite a bit of interest for people to have it, because it's just a talking point, and I think it gets people engaged. As you can see, it's been really popular.
I found some of the exhibits really powerful in that sort of the person sitting and you can't see the face, and it's like, to me, it's like being in a fog when you're breathless, you know, or you can't see the wood for the trees, and you're trying to sort of find your way out, but you're sort of stuck. So I found that one really powerful, and certainly the staircase, because patients that I see, their real number one problem tends to be, I can't climb the stairs, I'm so breathless, it's so difficult. So we try and unpick it and give them techniques to do so that they're able to manage it. And they often come back and see me and say, do you know, that breathing technique really helped me.
So the piece of work that was mine was the one with the clocks on. So I wanted people to realise that as your disease progressed, then your world would alter, because it would get smaller, because you're limited as to what you can do. But I wanted to make the point that you still have to maintain a positive attitude. I think it makes people look at things in a different way. It gives them a different perspective, and it makes them think about things. The lady with the head in the cloud was one of my ideas as well. And I wanted to explain that when you can't breathe properly, it's like breathing through a cotton wool. So the cloud represents cotton wool, and that's what it's like. And I think that when you see a visual image, it puts the idea across.
If people question the artwork that's on show today, they will understand how people feel. And that shows you, you know, sort of, and how you want to hide yourself away in the geraniums, and the slog up the hill in the car. You know, that tells me, I know that is how you feel sometimes, just like that. So if people ask questions about it, then they will know what you feel.
One that did stand out was, I loved how you looked at the positive effects as well. So like when people have adapted to living with breathlessness, I love that, like overcoming. I think that was brilliant. So there was one with the sunflowers, and showed how you know, all the fab experiences that, you know, that lady had done. And I think that was really beautiful in the fact that it showed that she still was living the life and doing what she wanted to do. It didn't let her stop her, and I thought that was really powerful as well.
You can never go back to being normal, because every time you get a cold or an infection, they tell you can't quite get back to where you was, so you're gradually going downhill. But with a little bit of help, a little bit of exercise, and a good outlook, and if your outlook's good on yourself, you're going to be a long time dead, and that's what I aim to be, a long time dead. I've got so much living to do. I've still got a lot of things I want to do.
I have really enjoyed the exhibition. I found it's inspirational, it's exciting. It's what's most exciting about it actually is to see some really fantastic research around breathlessness come to life in the form of this art exhibition. And it's a real insight actually, it's a real visual striking insight into what it is to live with breathlessness, because when you see those pictures of stairs and the insurmountable obstacles that they represent, or people representing themselves to be smothered or suffocated, it just really brings it to life as to what it actually is to live with breathlessness. So I think it's based on amazing research, and it really just brings it to life in a way that, reading an article or a journal or whatever might not do, and yet it's just really, really impactful.
It's a really nice show of the patient's difficulties and also the positivities that patients feel with breathlessness, which in itself is one of those things we do try to get across to patients, that just because you're breathless doesn't mean you're useless anymore. There are still some things you can get on and do, but also recognising that there are some challenges there, and what can we do to help you get over those challenges to turn them into positives for you.